So the bone formation and growth, there's two different stages of bone formation. One is ossification. It means that the bone matrix is formed, and osteocytes are there now after the bone matrix is formed. Then is the calcification part, which is the calcium precipitates. Ossification has two different stages. One is called endochondral, and the other one is intramembranous. Endochondral is coming from cartilage, and that's why they call it cartilage bones. And most of the bones are made of, from cartilage. The second one is called intramembranous, and that is coming from a fibrous membrane. This is actually mesenchymal membrane, which means that it is an embryonic type of connective tissue, and that mesenchymal cell can convert to a primary bone. That's why they are called membrane bone or membranous bone. The examples of these are clavicle or collarbones and some of the cranial bones. After the ossification takes place, either through the cartilage or through the fibrous membrane, then the calcium precipitate, and that is calcification, and that makes the bone harder and stronger. So let's talk about the endochondral ossification first. The images, these images might be a little bit different from the textbook, but it's the same idea. So in the endochondral ossification, they are made of hyaline cartilage. There's three types of cartilage. One of them is hyaline cartilage, so just chapter 4 again. So here in this area, if you look at it, you have the perichondrium. Perichondrium is wrapping around the cartilage. It's made of two layers. One is the fibrous layer, and the other one is the cellular layer. And there should be here, it's not shown here, there should be stem cells. These stem cells convert and becoming chondroblast. And chondroblasts are releasing, cartilage matrix. And once the cartilage matrix is formed, then the chondrocytes are trapped there in the lacunae. These are the cavities, and these are chondrocytes there. So all over in this area, all over is something like this. But as the fetus grows, then these stem cells convert and become osteogenic cells. So now osteogenic cells will make osteoblast, and osteoblast will make what? Will make bone matrix here. So now the bone matrix is formed here, and then it's calcified, so calcium precipitates, and the osteocytes are trapped there, and now this is actually a bone is formed there. So this bone is formed around this area in the diaphyses, and these are called the bone collar. If you remember, cartilage is one of the tissues that does not have direct blood supply, so it's avascular. So when these bones are formed here in the periphery, so there is nothing, new nutrients are coming through diffusion, and these chondrocytes that were here, they die, and they leave these cavities here. So these are the cavities that remain, and this looks like this now. Okay. So then the blood vessels come to the area. The blood vessels and the diaphysis comes here, and this the osteoblasts are formed, and then is calcified, and osteocytes are formed here. So then this area become the primary ossification center. So first bones are formed here, and then once the bone matrix is formed, then it's ossified. So bone ossification center is happening here. So ossification means before calcification, but calcification will take place. Also, the same idea happens in the epiphysis. So blood vessels comes here. These are the secondary ossification centers. So bones also form here, and then it's ossified. And finally, the periphery of the diaphysis becomes thicker, and this is making the compact bone. inside there some changes will happen because of the osteoclast activity. These are osteoclasts. So this is the bone marrow is formed there. This is very vascular, this area. This is where the blood is formed. And in the in the epiphysis that you can see, this is the spongy bone is there. So there's no medullary cavity, and blood is still formed here. The two ends, still will have cartilage, because this cartilage is important for movement of the bone. Otherwise, if two bone contact to each other, there's a lot of friction and damage, inflammation will happen. But these cartilages are actually preventing any kind of damage in the bone when you're moving your joints. And also in this area, it's called epiphyseal plate or epiphyseal growth plate. This is where the bones, new bones are formed, and the bones are elongated, so becoming longer in these two areas. When you're young, this area is open, and later on this area fuses and calcifies. So this is the histology picture of an endochondral calcification. This area is the cartilage area. This is the cartilage matrix. And this area that you see, these are the lacunae. Inside the lacunae, you have chondrocytes. You have chondrocytes here. Then you have the osteoblasts around this area. These are the osteoblasts, and they release bone matrix. So this pink area that you see, this is the bone matrix. Okay, and the osteoclasts, hard to see it in this image, they create this kind of cavity, this irregular cavity, and that is initial part of the medullary cavity. So initially it creates like this, and then they join and become bigger and bigger. There's two ways that bones grow under endochondral ossification. One is called appositional growth. It means that the thickness of the bone become increased, or the bone becomes thicker. If you look at this image, here you see the periosteum here in the periphery, and these are the circumferential lamellae. Periosteum contains a cellular layer that I told you before, and that cellular layer has osteogenic cells, and these osteogenic cells will make a new layer, okay, a new layer of circumferential lamellae. And another thing is that the periosteum also have blood vessels. So there's two things here. One contains blood vessel, the other one has osteogenic cells, and those osteogenic cells will make new circumferential lamellae. Once these new circumferential lamellae are made, they are wrapped gradually around these blood vessels. You can see that they're wrapped around the blood vessels, and now it's making concentric lamellae. From circumferential, concentric, you still have the central canal here, and this central canal together with the concentric lamellae will be what? The osteon. So new osteons are formed from circumferential lamellae. So the bones become thicker over time. Also the bone become longer. The part that is responsible for that is the epiphyseal growth plate, or cartilage growth plate, depends on the source that you read is the same meaning. And so this is in the metaphysis in this area. So there's a cartilage there, and the cartilage grows and going this way, and this area become calcified, ossified, and then calcified. Okay, so then the new bones are formed here, and the bone become longer and longer and longer like that, until this area is open and the person grows. Once this area is closed, then the person does not grow. So women are, more, this area in women are more susceptible for hormones. So when the estrogen is released during puberty, this area is more sensitive to estrogen, and that's why it fuses faster. In men, or in boys. It doesn't. What happens that this area is not as sensitive to testosterone, so this area will stay open longer. So this is why in majority of the cases, not all the time, but in majority of the cases, men have a higher, they have a higher height, or they're taller than women. That's the reason, because of this problem, that in women this cartilage is more sensitive to sex hormones. So before I talk about epiphyseal line, let me talk about the X-ray. So X-ray is a 2D black and white image. So when the X-ray radiation passes through the tissue, the absorption is different. If it is the tissue is solid, there is more absorption. And you can see that the bones have a lot of calcium, they are solid, so there is more absorption. When there is more absorption, the area looks whiter. And if it is a soft tissue, or if there is a fluid or air, there is less and less and less absorption, so the area looks a little bit grayish, because this is a soft tissue, the muscles are there, and here is air, so it's very, very dark. Now if you take an X-ray, you can see the difference between a person that is younger and the person that's a little bit older. So when you are younger, these epiphyseal growth plates are still open. These arrows are not very accurate, so these are still open, and the cartilage is not calcified, so that's why it looks grayish in color. But once the person grows and these cartilages fuse and become ossified and calcified, then these arrows are not accurate. Okay, so it should be this area, this area, this area, this area. This is actually accurate, but it's a little bit, still a little bit open here, and this area. So these are the ones that are closed, or mostly closed epiphyseal growth plate. So it means that this person may not grow much, but this person is still growing. So this is important for chronological age. So if some patient comes and you want to know the age of that person's chronological age and biological age, that way if the person still has a chance to grow, or the person has already grown and will not grow much. Also depends on some for criminal records. If you find some bones, they can take an X-ray, so then it can be used to determine the age of the person that died, and that way it can be used for criminal investigation. Endochondral ossification. So we are still in that. So how the bones mature. So in infant, this is the part that is the compact part, and this is the periosteum around it, and this is the medullary cavity. So you can see the bone is very thin, but circumferential lamellae are added, and that's making the bone thicker and thicker. Okay, so the circumferential lamellae are added here, becoming thicker and thicker throughout the adulthood, and that circumferential lamellae is under the periosteum. But something else happens here. There's a lot of osteoclasts are there, and these osteoclasts are destroying the bone because the body needs the calcium, and the bone marrow also over time increase in size. So as a person is very young and the person becoming older and older and older, and the thickness of the wall of the bone or the compact bone increase, but also the medullary cavity size increase as well. Intramembranous ossification. So it's a little bit different here. You have these mesenchymal cells, and these mesenchymal cells, these are embryonic cells, they convert and they become osteoblasts. So the function of the osteoblast is making some collagen fibers, okay, and also making this bone matrix or osteoid. Once these bone matrix are made and calcified, then these osteoblasts trap here, and that become osteocyte. So in the periphery, these mesenchymal cells are becoming more organized and they form periosteum. Now the blood vessels come here, so some of them will stay in the periosteum, some of them go in the middle of the area that were making some bones. These are called woven bones because they are irregular in shape, they are soft, they are not very well organized, but it is different than the periosteum, very different than the periosteum. So they have different cavities, and this is something that will convert to the lamellar bone. So this lamellar bone is more organized here. These cavities increase, and they will make this spongy bone in the middle, and in the periphery it will create a compact bone. So this is very different than the woven bone that is very weak. Also, this area of the periosteum changes, and they become two different layers: the superficial layer, that is the dense regular connective tissue, and the inner layer, that is a cellular layer, and that contains osteogenic cells that can be used later for growth and repair. The blood supply of the bone is very vascular compared with cartilage, which is not vascular at all. Most bones have at least one blood supply. So here you can see that the blood supply entering the bone or leaving the bone in the middle, in the diaphysis area, and inside the medullary cavity is very, very vascular. But also you can see this vascularization in the epiphysis area. Some bones that are very big, they can also have their own blood supplies in the epiphysis area. So not a lot, but some bones may have that. For example, femur in the legs, and not in the legs, in the thigh area. So bone remodeling. Sometimes you need the calcium. So when you need the calcium, bones are a big reserve of calcium in the body. So that calcium from the bones, they are released, and that goes to the blood. Or sometimes when you do not need too much calcium, that calcium goes from the blood and precipitates on the bone. So this happens throughout life all the time, and this whole concept is called bone remodeling. When there is more deposition of calcium happens to the bones become stronger, okay? And if the calcium is removed from the bone, then the bones become weaker. So this is the process that happens. If the level of calcium decreases, the pre-osteoclast, that becoming osteoclast. Osteoclasts are releasing enzymes and acid, and that will cause bone resorption. Bone resorption means calcium, calcium is released from the bone. It means that the bone is destroyed, and that goes to the blood. So that takes about 2 to 3 weeks, and then these monocular cells are coming, and they stop the activity of osteoclast, and at the same time the pre-osteoblasts come to the area and they convert to osteoblasts. Now these osteoblasts will release bone matrix. Now the ossification happens. Then this bone matrix are calcified, then the osteocytes are formed, and this area is healed. So this process takes about 3 months, roughly. Okay, this is not exact science. It's 2 to 3 weeks here, 2 to 3 months here, average 3 weeks here and 3 months here. And the same process can continue again and again and again.